like I said, we're here to talk about the 3 secrets that are going to help you break free from pain and take your life back without having to rely on doctors, drugs, or surgery. Now, in addition to breaking free from pain, we're also going to be talking about how to build a more youthful, energetic body, how to fix your posture, how to have more energy and move better than you ever have, as well as one hidden secret to longevity that almost no one is talking about. One other thing, this presentation is geared towards people that are suffering from the most common forms of chronic pain, to include low back pain, mid back pain, neck pain, headaches, fibromyalgia, and then all the various types of different joint pains, whether it be knees and elbows and shoulders and hips and these kind of things. You guys are absolutely in the right place. If, on the other hand, you're struggling with some of what I would call the more unusual types of chronic pain, things like phantom limb pain or pain secondary to your whole spine being fused or things like that. I want to be fully transparent and not waste anybody's time. This is geared towards the most common pain conditions in the world. There's somewhere in the neighborhood of 1.5 billion people in the world suffering from those types of pain, and that's who this presentation is going to be geared towards. If you have phantom limb pain, I do wish you all the best. There are fantastic ways to treat it, and if you get in touch with customer support, we might even be able to refer you to a great practitioner in your area, but this is geared towards the most common types of chronic pain. So moving on, who am I? My name is Dr. Yoni Witten. I'm a board certified doctor of chiropractic. I've been in clinical practice for 15 years now, and while we're being completely transparent, it's you guys should know that I actually never started out with the intention of working with people in chronic pain. In fact, that was the last thing on my mind. My entire undergraduate education was geared towards performance enhancement and basically making athletes run faster and jump higher. And that's what I set out to do when I got into chiropractic practice, is help athletes to do that on an even higher level. And then something really interesting happened. Within 2 years of being in practice, my second year in practice, this patient comes in. His wife was already a patient. She basically dragged him into my office, kicking and screaming. And to this day, it's one of the most challenging cases I've ever had. This guy had a neck that couldn't move 1 degree in any direction. Okay, the nerve supply down into his arms was being restricted, and he'd completely lost the use of his dominant arm, couldn't move it at all. The muscles had actually started to shrink because it wasn't getting any nerve supply. And his non-dominant side had lost about 50% of the use. This guy was in excruciating pain. He hadn't slept in months, making things even more complicated. He'd already been to see 3 other doctors. 2 of them kind of stared at him like deer in headlights and said they couldn't help him. The 3rd one actually made the guy worse. So he was terrified in addition to being in a lot of pain, and he didn't want to be in my office. I did the examination, and I'm new in practice. Red flags are popping up left and right. I'm scared. He's scared. And I just saw so many things there that would indicate that he wasn't going to respond to treatment that I referred him out. I sent him out for a neurosurgery consultation. And I was patting myself on the back after he went. I said, look at that. I did what the school taught me to do, to recognize this extreme case and send him to the appropriate practitioner. But about a week later, I get a call from his wife, and she's in tears. She says, we've been to the neurosurgery consult. He wants us to do all this testing and imaging. And long story short, we can't afford it. We can't afford to do any of the testing and the diagnostics that this guy needs. Rewind a little bit. The gentleman who had come in was a sign painter. He did these amazing murals for like the chic restaurants and bars in downtown San Diego here. And because he hadn't been able to work in several months, they were just in a state of financial hardship. So the wife is telling me this. She's in tears, and she says point blank to me, "Will you help my husband?" And I kind of sat with it for a second and caught my breath, and I reluctantly agreed. if I'm being 100% honest. And the guy comes in, we start working together, and it is slow as molasses. I mean, I realized very early on that I can't do most of the things that I've been trained to do because it puts him in more pain than he's already in. And you can't resolve chronic pain by doing that. So I had to go back to the drawing board completely. And what I did was I took his pain completely off the table, and I said, I'm just going to focus on restoring normal range of motion to his neck. He couldn't move his neck 1 degree in any direction, not up, down, left, right, nothing. So I said, I'm just going to work on that. We worked on it. We worked on it. We worked on it. It was really slow. Then after about 2 months, he comes in one morning and he's got this weird smirk on his face. And I said to him, I said, what's going on? What's with the look? And he says, Doc, I slept last night. I go, what do you mean? He goes, yeah, I slept all the way through the night. He goes, I haven't been able to do that in like 6 months. And a light bulb went off over my head. I said, okay. And we kept going down that road. And about a month later, I did a reevaluation on him, and he had about 50% of the range of motion with rotation in his neck. He was sleeping through the night consistently now, and he was starting to get some of the muscle mass back in his right arm. Fast forward a couple months after that, and he's got about 85% of the range of motion back into his neck. Muscle mass in his arm is mostly back, and he's recovered most of the functionality in both arms. A few months after that, he is completely recovered. He's back to painting signs. Him and his wife are back on their feet financially. And this, for him, was a very special thing that he can get his life back. For me, it absolutely altered the course of my practice. So now, about 13 years after seeing that patient, I have a niche practice here in San Diego. We focus almost exclusively on the resolution of chronic pain conditions like the one I just told you about. And we're having a lot of fun. And I have a bunch more stories like that about patients who had lost their quality of life and then got it back. And it's a really fun way to spend my days. So the impetus for creating this program was exactly that. What if I could teach people to improve their functionality, improve their mobility, and thereby improve their quality of life and get back to doing things that they haven't been able to do, in some cases months, years, or even decades. And that's what I hope to share some of that with you guys today. So jumping right into this, secret number 1 is that the conventional approach to treating chronic pain is flawed at its core, and it has no real chance of resolving your chronic pain. This is important to understand when you're starting out, because if you've gone the conventional medical route and you've tried to resolve your pain that way and you failed, you need to know that it's not your fault, because you never even stood a chance going that route. Conventional medical model for treating pain flat out doesn't work. And we know this because the overwhelming majority of people that develop chronic pain stay in pain. And the reason for this, the reason so many of those people stay in pain, is because of this huge gap between what science knows about pain on one side and what conventional medicine is doing to treat chronic pain on the other side. It's not that your doctor's a bad person or that they don't have a deep desire to help you. Far from it. But the conventional medical system is not set up to effectively deal with the types of pain conditions that affect the majority of people in modern society. And because of that, people with these types of conditions end up being marginalized, pushed off to the side, or ignored altogether until their conditions become so bad that they require the invasive interventions that medicine has to offer. Now, you need to recognize what happens when you go into the conventional medical system so that you can kind of sidestep the little landmines and booby traps that are there. So what's going to happen if you go into that system with a chronic pain condition is the following. They're going to take a simple 3-step approach. First, they're going to do a quick examination of the painful area. Next, they're going to send you off for some basic imaging. This is almost always an X-ray. And this is also a critical turning point. Because if that X-ray comes back and there's no fracture, no dislocation, Heaven forbid, nothing exotic, no signs of cancer, nothing like that. Then you move on to part 3, which is what I call the clinical dismissal. This is where you're politely sent home, armed with a prescription for painkillers or anti-inflammatories, another for muscle relaxants, and a recommendation to rest or immobilize the painful area. And the idea behind this treatment prescription is simple. It's that if we can cover up the pain and you don't feel anything, then your problem's been resolved. Pretty simple. See, pain in and of itself is not an imminent threat to your survival. Pain's not going to kill you. It might ruin your life, but it's not going to kill you. So because it's not on the level with some of the things that conventional medicine deals with, say you came in with chest pain, they got alarms going off left and right, sirens blaring, they're getting you right in, they're going to test you forever until they figure out what's going on. For sure, they're going to rule out the really serious things that could kill you this fast. Now, chronic pain in most locations is not apt to be something that's likely to kill you very quickly. So conventional medicine just doesn't take it seriously. Their response to most of these common pain conditions can be summed up with the idea of, I'm sure your problem will just work itself out, or why don't you come back and see us when you have a quote unquote real problem? Translation there is a life-threatening emergency, which is what conventional medicine does phenomenally well. And we should all be appreciative that they're there if and when we ever need those types of services. But for chronic pain, it's a very different story. So case in point, I had a patient come in recently complaining of severe shoulder pain with radiation down into her arm and down into her middle back. Now, she'd already been into urgent care and followed up with her general practitioner for this pain. At urgent care, she was examined and x-rayed, but they didn't find anything other than some mild degeneration, nothing that would explain her pain. So they gave her high-dose ibuprofen and sent her on her way. Clinical dismissal. A couple weeks later, she comes back, follows up with her general practitioner. The pain hasn't changed. Okay, so he takes her off the ibuprofen, puts her on OxyContin, right? I'm going to throw the house at this thing. A few weeks after that, she comes in to see me, and pain hasn't changed. From the shoulder, down the arm, down into the middle of her back. And I said, well, what's going on? And she goes, she admitted to me that she'd had like off and on neck pain for years, but nothing to this type of severity. So I start thinking like, what's going on? And she says, well, I've had ibuprofen, didn't work. I've had OxyContin now for a few weeks, didn't work. My general practitioner says the next thing that they're going to do is do a cortisone shot. And I said, okay, what are they going to shoot the cortisone into? And she kind of stared at me. And I said, well, cortisone is an anti-inflammatory. So what do they think that, what structure is inflamed that's causing you pain, basically? And she shook her head, you know, and I said, well, I don't understand. And she goes, well, that's just what they told me. And that's the truth of how most of these things actually happen, you guys. And you need to know this, that a lot of times with conventional medicine, they're throwing drugs at something and they're doing procedures that could best be described as symptomatic relief without even digging a layer deeper and figuring out exactly what they're treating. And that's part of the reason why, like I was saying earlier, so many of people that start out in pain stay in pain. I mean, can you even imagine what it would be like if other professions operated the way that conventional medicine does when it comes to dealing with pain? Let's take this example. Imagine that you call the gas and electric company out to your home complaining that you have a terrible gas smell inside of your house. Now, of course, they're going to take this really seriously. The technician, he's eager to help. He shows up at your house. He checks the furnace. He inspects your hot water heater. He runs diagnostics on your oven and stove, but he doesn't immediately find anything. So he closes the oven door, politely hands you a nose plug, and heads off to his next service call. That's it. No further testing to figure out where that smell is coming from. No additional thought given to the horrible odor inside of your home. Just here, put this on. That ought to take care of it. I mean, after all, if you can't smell the gas, then you don't have anything to worry about, right? As silly as that sounds, conventional medicine is using a similar thought process when it comes to dealing with many of the most common pain conditions in the world. And it's in direct conflict with how they handle a great number of other problems. I mean, imagine that you go into the same conventional medical system to see the same doctor, and you've got even the slightest sign of heart disease or cancer. If you do, alarms going off left and right. You are going to be sent out to the best oncologist or the best cardiologist that they've got. You're going to be given EKGs and stress tests. You're going to be given specialized imaging, genetic screening if it's applicable, and blood tests. They're going to test and test and test until they get to the bottom of what's causing your problem. But with chronic pain, not so much. And this is very strange because according to the National Institutes of Health, chronic pain costs the United States about $100 billion more every single year than heart disease and cancer combined. So why is it that conventional medicine is not interested in getting to the root cause of these problems? What it comes down to is that the conventional medical approach to treating pain is built upon a foundation of 3 false beliefs. False belief number 1. That medicine automatically gets a pass because they have all this amazing technology. It's just assumed that they're using the best technology and the most proven treatments for chronic pain. Myth number 2 is what I call the wait and see approach. This idea runs rampant in conventional medicine, that is that if you just give these pain conditions some time, they just disappear on their own. Myth number 3 is that drugs are an effective solution for dealing with chronic pain. Let's jump into each one of these. Myth number 1, the technology myth. Here in the United States, we're constantly patting ourselves on the back for all this amazing tech that we have. And so we just kind of naturally assume that because we have all this technology, that's going to resolve all of our problems. But when it comes to dealing with chronic pain, that's not always the case. According to one of the leading medical journals in the world, The Lancet, when they did a huge series on chronic back pain, was published back in November of 2018, doing things that don't work has actually become one of the hallmarks for chronic pain treatments in the United States. The Lancet article talks about what they call a gap between evidence and practice. In other words, what the science knows and what practitioners are doing to treat chronic pain. They specifically say that ineffective therapies are used way too often and that things that are shown to work are significantly underused. So what ineffective therapies are they talking about when things that are used way too often? Specifically, they're talking about that medicine does too much imaging. They prescribe too many pain-killing drugs, especially opioids, which have gained a ton of attention over the last couple of years. They're giving too many injections. What they're talking about there is pain-killing injections like corticosteroids, and they're performing way too much surgery. The article slams conventional medicine for what they called a complete lack of focus on prevention. They're not focusing on how to avoid these problems in the first place. The weird thing here is that we already have treatment guidelines that have been developed by experts at the American College of Physicians and the American Pain Society. These are people that are specifically working with chronic pain. They know the science, they know exactly what to do, and they've laid it out for us in very clear steps. And they've even broken it down according to tiers. So tier 1 is when a patient first comes into the system, and this is what they recommend. They say specifically that the patient should stay active, get regular exercise. If they're working, they should absolutely remain on the job. These things are critically important. They also talk about using focused breathing techniques like those in yoga or Tai Chi, and then mindfulness and relaxation strategies. One thing that they go on to specifically say for tier 1 is non-pharmacological treatment, meaning no drugs, okay? This is important to understand. And here's that gap that we were talking about in the Lancet article between evidence and practice, because the number 1 prescribed treatment for pain from physicians is non-steroidal anti-inflammatory drugs. That's Advil, ibuprofen, Motrin, Aleve, Celebrex, things like that. Now, this is in direct conflict with the expert recommendations. So Well, right about now, we would be thinking that if this is the number one thing, at least it must have a pretty good track record for resolving these problems, right? Again, here's that gap, that gap between evidence and practice. One famous pain researcher concluded after looking at all of the data on nonsteroidal anti-inflammatory drugs and back pain, the most common form of chronic pain in the world, that, quote, there's no evidence to suggest that NSAIDs are helpful in chronic back pain or sciatica. No evidence. Furthermore, these drugs come with a pretty horrible list of side effects. According to the American Journal of Medicine, conservative estimates place these drugs as the responsible factor for over 100,000 hospitalizations each year and over 16,000 deaths. Now, adding insult to injury, doctors are still prescribing rest. In fact, this is the second most commonly prescribed treatment for chronic pain conditions. This is in, again, direct conflict with the expert recommendations from the American College of Physicians and the American Pain Society. Furthermore, there's little, if any, justification for this recommendation, because what the research conclusively shows every single time is that rest is extremely harmful and that it actually delays recovery. Okay? The thing that we're recommending delays recovery. The overall conclusion from that Lancet paper from 2018 was that, quote, there needs to be greater recognition that much of the care for back pain is unnecessary, ineffective, harmful, and is making the problem worse. Do you get that? What we're doing is making the problem worse. All the time, energy, resources, money, everything we're pouring into this is leading to worse outcomes. We would be better off doing nothing. Now, before we all get too excited that this research has come out, and by the way, good on the Lancet for putting this out, and hopefully conventional medicine pays attention, but you need to know that this is not the first time this information has come out. Back in 2010, the scientific community basically came to the exact same conclusion. It was a large-scale study on chronic neck pain published in the journal Arthritis Care and Research. And what they found was, quote, an overutilization of diagnostic testing, too many narcotics and modalities, and the underutilization of effective treatments like therapeutic exercise. Too much of what doesn't work, not enough of what does. And way back in 1987, the journal Spine published something eerily similar. Quote, traditional methods of care involving rest and passive treatment modalities rather than activity have been implicated in the alarming rise of people disabled by back pain. The treatments are leading to an alarming rise in people being disabled by the condition. So you see, these problems have been well known and documented for the past 3 decades, yet little, if anything, has changed in that time in the way that conventional medicine treats chronic pain. The problem seems to have only gotten worse. So in spite of all of this great research, conventional medicine is not using the best science or the best treatments for treating chronic pain. So right about now, if you're like me, you're probably scratching your head and going, why the heck would we keep doing anything other than the best possible thing for patients? And the sad truth, according to that Lancet article, is that in countries like the United States, surgeries, injections, and medications like opioids tend to be better covered by insurance. And it's hard to say, but what's happened is our medical establishment is being run by people that have business degrees, and they've gotten really good at finding out what insurance companies will pay for, and unfortunately doing those things in spite of the fact that they're not the best thing for the patient. Myth number 2, this is what I call the wait and see approach. The idea here is really simple. It's that if you give these painful conditions some time, they're just going to go away on their own. This is the most pervasive myth surrounding pain treatment in modern society. Now, if you look at some of the literature on pain, you're going to see it littered with comments like these. Quote, Most pain and related disability will resolve within a couple of weeks. That's from the British Medical Journal, and they're talking about back pain. Quote, the majority of patients fully or partially recover within 6 weeks. Again, the British Medical Journal speaking about back pain. This one's from the American Family Physician. Quote, most cases of sciatica will resolve on their own with no special treatment within 3 to 6 weeks, just like low back pain or a crick in the neck. So you read statements like these and you think, this is no big deal. But my question is this: if back pain goes away in a couple of weeks, so fast, just like that, all on its own, and you don't have to do anything for it, why is it the leading cause of pain and disability in the whole world? Something's not right with that. See, statements like those give the mistaken impression that pain's no big deal. And what this amounts to is a rationale for not addressing the problem. It's a justification for the clinical dismissal. Why would you ever bother digging to uncover the root cause of these things if they're just going to disappear on their own, right? It makes perfect sense to blow it off. But the problem is that when you blow it off, you're not resolving the problem. And when you blow it off, the vast majority of pain sufferers do not recover from their conditions. Do you guys know what the #1 predictor of back pain is? The #1 predictor of back pain is a previous episode of back pain. Okay? It's not hard to believe, right? But that's the defining characteristic of chronic pain. It's relapse. That's pain that goes away and comes back. So one famous pain researcher looked at a bunch of different studies, like 14 different studies on back pain. And the average relapse rate across all of these studies was just under 60%. 60% of pain sufferers experience pain that goes away and comes back again and again and again. There was even one study, large-scale study out of Europe, where they found that only 6%, just 6% of people experienced a single non-recurrent episode. That means that according to the data from this study, the other 94% of pain sufferers experience pain that goes away and comes back again and again and again. And that's the truth about chronic pain for most people. One researcher called it, quote, an untidy pattern of grumbling symptoms with periods of relative freedom from pain and disability interspersed with acute episodes, exacerbations, and recurrences. So it's that constant up and down. Oh, I'm a little better. Oh, I'm way worse. Oh, I'm debilitated today. Oh, the next day I can move. But the problem never gets solved. Myth number 3 about dealing with chronic pain is that drugs are an effective solution for these problems. Now, this one is we're going head on into the most commonly prescribed treatment for chronic pain conditions. Historically, this meant non-steroidal anti-inflammatory drugs, which, as we've already discussed, are not helpful with chronic pain. But in the 1990s, the stakes were raised, because it was around this time when a powerful class of pain-killing drugs called opioids really started becoming popular for the treatment of chronic pain. Now, according to the Centers for Disease Control, prescriptions for opioids increased by 400% from 1999 through 2010. And for those of you that aren't familiar with these drugs, we're talking about things like oxycodone, oxycontin, hydrocodone, morphine, Vicodin, methadone, things like that. Now, here's the weird thing. We've started prescribing now in the 1999 the most powerful class of pain-killing drugs in existence. Okay, and we're ramping it up at an incredible scale. We're giving the most powerful drugs. We're giving more of them than ever before. And despite of this massive increase, the number of people in pain continued to go up. Okay, according to the Archives of Internal Medicine, a study from 2009, chronic back pain that led to back disability increased by 260% during the prime years of opioid prescriptions. So how do we make sense of this? How do we make sense of the fact that we're giving the most powerful drugs we've got, we're giving more of them than ever before, and the number of people in pain is going up? Well, in 2016, a pair of researchers out of the University of Colorado at Boulder made a really interesting discovery. They found that taking opioids for just 5 days led to an increase in pain intensity and pain duration. They said, quote, The implications for people taking opioids like morphine, oxycodone, and methadone are great, since we show that the short-term decision to take opioids can have devastating consequences of making pain worse and longer lasting. This is what the Lancet was talking about. The treatments that we're using are making the problem worse. So not only have these drugs failed to solve the pain problem, they've actually made things worse. Just how bad? Well, deaths due to prescription opioid overdose increased by 500% from 1999. And we're now at a point in American society where opioid overdose is the leading cause of death for Americans under the age of 50. That's how far we've gone. So the current approach to treating pain in the conventional model hasn't just failed you, it's failed everyone. It's based on an unscientific model with nearly a 2-decade-long track record of death and disaster. I don't want you guys to fall into the trap that so many other people have fallen into. The reason that people are willing to take these incredibly powerful, dangerous substances is because they're stuck in this dark place with pain, and they'll do anything to get out of it. But here's the thing. If you're going to get out of pain, you've got to start by changing the way that you think about pain. Pain is not your enemy, and it's not out to get you. Pain is like the check engine light in your car. It's a signal from your body and your mind that something is wrong. And the right thing to do when that light comes on is to figure out what that problem is and fix it fast before it leaves you broken down and stranded on the side of the road somewhere. But one thing that you absolutely should never do is just cover that light up with black tape or turn a blind eye to it and keep on driving and thinking to yourself that, if I don't look at it for long enough, or if I can't see it, that the problem is just going to magically go away on its own or resolve itself. Because if you do that, you end up broken down on the side of the road sooner or later, every time. Secret number 2. When it comes to the treatment and permanent resolution of chronic pain, kinetic flow is hands down the most important factor to consider. Yet, this is the one factor that people suffering with pain and their doctors fail to recognize and consistently overlook. And this is solely responsible for keeping hundreds of thousands of people trapped in pain. Now, over the last 25 years, science has made some absolutely remarkable discoveries regarding the critical role that movement plays in human health. For example, it's now considered common knowledge that movement increases your energy levels, it improves your mood, it enhances your learning capabilities, it promotes better sleep, and radically decreases your risk for certain diseases like obesity, syndrome X, cancer, diabetes, heart disease. And for the most part, these things have been embraced by the general public. People know this stuff. But one of the biggest scientific discoveries related to movement has been completely ignored by both the medical establishment and the general public. Now, that discovery came in 1993 when a guy named Husheng Hushmand found that reductions in something that I call kinetic flow led to a direct increase in subconscious pain signaling in the body. I'm going to say that again. Kinetic flow goes down, pain signals in the body go up. That's a pretty important thing to know if you're struggling with chronic pain and you're trying to permanently eradicate that problem. So what is kinetic flow? Well, I want you to think of kinetic flow as a massive river of neurological information that's constantly flowing from your body up to your brain. So tons of neurological data constantly flowing from your body up to your brain. This information carries with it this data carries with it much of the information regarding your body's physical relationship to its environment. The bulk of this information is produced by movement, especially movement of your spine. Okay, but it also includes data from receptors that are spread throughout your body that track the position and exact location of every single body part, much like a GPS unit would. There's little receptors inside of your muscles and tendons that track their precise length and tension. And then there's even pressure receptors spread throughout your body that help to keep you balanced, upright, and stable. And these are constantly relaying this critical information up to your brain. Now, if that sounds important, It is. This is the reason why more than 50% of the mass of your spinal cord is dedicated solely to carrying this information up to your brain. More than half of your spinal cord just carries kinetic flow up to your brain. See, we need kinetic flow in order to successfully navigate life. But on a much more basic level, kinetic flow actually provides much of the raw energy that's required to run your brain and nervous system. Back in 1981, a guy named Roger Sperry found that 90% of the stimulation and nutrition to the brain was provided by movement of the spine. And he likened this to a windmill. So let me show you guys how this works. Imagine that you live in a city that gets all of its energy from one large windmill. So wind comes in and it pushes against the windmill and it causes the blades to spin. This spinning motion creates raw energy. That raw energy then flows to a control center where it's transformed into power for the city. So when the windmill's blades are spinning a lot, it means that a lot of power is being produced and the lights in the city shine extra bright, right? Your body works exactly the same way. When you're in motion, you're producing lots and lots of kinetic flow, and your brain is therefore able to operate at full capacity. But the reverse is also true. When you move less, you produce less kinetic flow. Less brain fuel results in less brain function. And this is the reason why they find in studies on children in classrooms that when they take them out of a traditional chair, like you see in this image, and they move them onto a stability ball, their alertness, arousal, concentration all goes up. Behavioral problems go down, test scores go up, just as a result of being on a dynamic surface. Now, why is that? When you're in the static surface, the chair is supporting your body. Your muscles don't have to do very much because the hard surface is holding you up. You have a back support, so you're perfectly stable. Not much in the way of kinetic flow is being produced in that situation. But you get on the stability ball, and all of a sudden you're on a dynamic surface. You've got to constantly be finding the balance point. You have to be engaging in this kind of coordinated dance of muscular activity to keep you balanced and centered in the ball so that you don't fall off. Your eyes are monitoring the horizon. Your inner ears are working, and your body's constantly shifting position. And what happens is test scores go up. This is across the board. Very interesting stuff. So going back to the windmill analogy, when that wind stops coming in, it means the blades of the windmill stop spinning, which means no raw energy is being produced, which means that there's nothing to send along to the control center. Soon enough, with nothing coming in from the control center, the lights in the city get dim, and then they go out altogether. Same thing happens in the brain. World-renowned medical authors, Guyton and Nolte, these guys are two of the most famous medical authors in the world. They literally wrote the book that medical schools use to teach physiology, have indicated that if your body stops sending these critical signals up to your brain, then your cerebrum would be, quote, incapable of functioning in a conscious manner and would actually approach a permanent state of coma. No kinetic flow, you rapidly approach a permanent state of coma. So by definition, kinetic flow is an essential nutrient, just like the air that you breathe and the water that you drink, in that your body simply cannot function without it. Now, I want you to think about a time when you held your breath underwater, like the longest breath hold you've ever done underwater. So you get there, hold your breath, and you go down, and you hold, and you hold, and you hold. If you can stay down for 30 seconds or maybe even a minute, imagine to yourself what you felt like when you were down there after holding your breath for that long. If you can stay down for that long, a full minute underwater, what's going to happen is your heart's going to start to pound and your lungs will start to burn. And if you can force yourself to stay down and stay down and stay down, every fiber in your body will begin to scream out in pain. Everybody knows what that signal means. That signal is telling you to go to the surface and give your body what it needs. When you do that, when you break the surface and you take that first big breath, the state of panic in your body and the pain associated with it disappear that fast, instantly. Kinetic flow works exactly the same way. See, throughout human history, we had to move. We had to move to hunt, to gather our food, to make fire, to build shelter, to build tools, and to find and carry water, to take care of our kids. Literally all of the activities needed to sustain life required physical activity. So choosing not to move in this environment was not an option. Not being able to move in this environment would have almost certainly resulted in death. And because of this fact, your DNA has been conditioned over millennia to treat the absence of movement as a threat to your survival. And when your body perceives this threat, it will react strongly using pain signals to get you to change what you're doing in the interests of self-preservation, just the way it does when you're holding your breath underwater. Your body's saying, you're compromising my ability to stay alive. I'm going to send a signal to your conscious mind to get you to do something about it before we push this thing too far and cause irreparable damage or death. That's the reason why such a large percentage of your spinal cord is dedicated to carrying this critical nutrient up to your brain. Because your brain and nervous system are hardwired specifically to use it for fuel, right? When this is coming into your body and being sent up to your brain, it means you're doing the things that you need to stay alive. But when kinetic flow is not coming in, your brain begins to starve, and all of a sudden your nervous system goes into alarm reaction mode. Okay? Now, thankfully, before you're completely starved of this and you head into that coma-like state that Guyton and Nolte will talk about, we're talking about, then your brain will detect that you're headed towards danger, and it will begin sending those conscious signals, up to the conscious regions of your brain, rather, to get you to do something about it before it's too late. Now, those signals that are asking for change come in the form of pain. Your body is doing what it needs to do to get your attention. So when we have that information, we start saying, well, okay, if a person is suffering with chronic pain, is there anything I can do to increase kinetic flow? Since we know that when kinetic flow goes down, pain signals go up. Thankfully, there's a bunch of research on this stuff, and there's a ton of things that we can do to up kinetic flow. So let's talk about a few of those now. First, we're going to talk about myofascial release. This is a deep form of hands-on body work that's intended to basically break up little things, bits of scar tissue in the soft tissue called adhesions, with the hopes of getting you to move better through a more complete range of motion. Studies on myofascial release are very impressive, frankly. They've shown that with as little as 2 sessions a week for 3 weeks, just 20 minutes each time, you can decrease pain levels, you can decrease sensitivity to pain, and you can increase the person's range of motion. Now, that's the pairing that I really want you guys to pay attention to as we get into this stuff, which is when pain levels go down, the person's ability to move goes up. So those two things operate like a seesaw. Okay. When a person's ability to move goes down, usually pain levels go up. Okay. The next thing that I want to talk about is whole body vibration. Now, these are those really powerful motorized platforms that people stand on, and they kind of shake you at a very low level, but a high frequency. And the studies on whole body vibration are pretty darn impressive. So one of my favorite studies was done on people with fibromyalgia. Now, for those of you that aren't familiar, fibromyalgia is one of the most perplexing forms of chronic pain. People have widespread pain throughout their bodies, and they're incredibly sensitive to pain. One of the diagnostic criteria is that you can apply just the lightest pressure, to just barely anything, to a person's skin all over their body, and they will experience pain as a result of that. So they took a bunch of people with this terrible condition, fibromyalgia, and they split them up into 2 groups. Okay. Both groups did the same series of exercises while on top of the same platform, the same vibration platform. The difference between the 2 groups was that in one group, that vibration platform was turned on and it was vibrating. And the other group, the platform was turned off. These people were tested at the outset of the study. Then they were tested at 3 months, and they were followed up with at 6 months. But the intervention itself, the exercises that they performed on the vibration, were performed 2 times a week for 4 weeks. So 2 times a week for 4 weeks, they're followed up with at 3 months and 6 months. Got it? Here's what they found. At the 6-month follow-up, the group that had done the same exercises on the vibration platform that was moving and vibrating had more energy. They moved better. They had less anxiety and depression. They were better able to do their activities of daily living, more time. They were able to spend more time driving and with friends and family. They had better sleep and they had less pain. And this was 5 months after the exercise program had finished. Absolutely incredible. Now, the researchers were, the funniest part is the researchers were basically left scratching their heads because they didn't know what they were going to find. They said, quote, "There's no clear consensus on the mechanism by which vibration may decrease pain, but there is evidence of its way of action." In other words, we don't know why this works, but we know it works. They went on to speculate that it was due to what they called, quote, "increased neuronal input," which we're calling kinetic flow. Another study that I want to talk to you guys about involves kinesiology tape. This one is absolutely fascinating because you would never think it to be the case. Now, kinesiology tape is that tape that you see a lot of athletes on television wearing. NFL players are constantly wearing, usually brightly colored tape on their arms is what you'll see. You saw it in the Olympics with beach volleyball players and sprinters. It's becoming way more popular, but it hasn't been out for that long. But anytime you see those brightly colored strips of tape on somebody's arms, legs, shoulders, back, those types of things, that's kinesiology tape. So here's a quick physiology lesson so that you can understand the importance of this study, because this study absolutely blew my mind. So when a person has no back pain, just regular person walking down the street, no back pain, and they go to move their limbs, when they initiate that motion, kinetic flow rushes up to the brain and basically tells the brain the position that the arm is in and the position that it's moving based on the muscular activation pattern. And your body anticipates what direction that arm's going to go. So say I'm going to throw something, your body anticipates the throw, and it basically gets a feedback loop from your brain that says, okay, I'm going to tighten up these muscles around the core of my body to make sure that I don't basically tip over when I go to move my limbs. And what they've found consistently in study after study is that when a person has back pain, it interferes with that kinetic flow going in, and so they get a discoordinated activation. They get a slow, weak, discoordinated activation. So the person with back pain who goes to move their limbs can't stabilize their core properly. They do it slower, they don't do it as strong, and they're more apt to experience injury as a result of this. So here's what they did in this study. They applied kinesiology tape along the spines of people with chronic back pain. Then they measured the muscular activity at the level of the nerves themselves, and they even went in and measured brain activity. And what they found was absolutely fascinating. They found that with a single intervention, the first time they taped these people with chronic back pain, they had way better anticipation, way faster muscular contractions. They had a better postural adjustment that was more accurate. They had increased range of motion and decreased pain. So there's that pairing that I was telling you guys about. When range of motion goes up, when a person's ability to function goes up, pain levels go down. And they found this in one intervention. The researchers summed up their results beautifully. They said, quote, "KT tape, kinesiology tape, continuously stimulates the neurological system, which decreases pain and increases functionality." Again, kinesiology tape continuously stimulates the neurological system. They're continually stimulating kinetic flow, which decreases pain and increases functionality. A couple more techniques that we're going to talk about for increasing kinetic flow. There's mobilization and manipulation and rhythmic movement. Now, for those of you that aren't familiar with mobilization and manipulation, this is when a person moves your joints with mobilization through their normal range of motion, and with manipulation through a range of motion that's slightly beyond normal into what's called the periphysiological space. So with mobilization and manipulation, there's a ton of research on this stuff. I'm not going to bore you guys with all of it, but essentially they've tested on everything from neck and back and shoulder pain all the way down to foot pain. There's a huge body of research And what they found is that pain reduction correlates linearly with increased range of motion. So that's the pairing that we've been talking about this whole time. Pain reduction correlates linearly with increased range of motion. Range of motion goes up, pain goes down. That's how it works. In one big study on neck pain, they found that, quote, the greater the increase in neck mobility, the less pain people had at rest. Okay? Mobility up, pain down. That's really important for you guys to know. And then with rhythmic movement is just, it really just blows the competition away. It's been shown to reduce pain in linear association with movement frequency. So I'm throwing another bit of information at you guys here. So pain goes down as a result of how often you're engaging in the rhythmic movement. There's good data on that. They've shown that rhythmic movement can reduce back pain in as little as 10 minutes, can reduce the intensity and frequency of headaches and migraines, and can reduce joint pain in some populations by over 70%. That's 70. The Journal of the American Medical Association knows exactly how important rhythmic movement is. They published a huge meta-analysis in 2016. Basically, they looked at the data of over 20 randomized controlled clinical trials. There was almost 31,000 participants in this study. And basically what they did was they analyzed and compared all these different interventions for back pain, again, the most common form of chronic pain in the world. And they said they pitted all these guys together in like a huge competition to say, okay, which one, we're going to answer the question, which one is most effective, who's the best? And they said, quote, rhythmic movement is the most effective method ever studied for preventing pain. Why? Because regular movement creates regular increases in kinetic flow, which feeds your brain the essential nutrients that it requires, thereby eliminating the need for your body to produce those warning signals that we've been talking about. And that's the takeaway here, you guys. Secret number 2 is that when it comes to the treatment and permanent resolution of chronic pain, harnessing the power of kinetic flow is the key. Utilized correctly, this is the most powerful tool that you have to condition your body to suppress pain signals. And over time, you can actually use this to reorganize the way that your brain and nervous system produce and interpret these signals. That's what I want to show you now. I really want you guys to come away from this with some concrete tools that you can begin using immediately. And obviously, I'm not recommending that you go out and try all of the techniques that we talked about. Some of them require specialized equipment that's super expensive, like vibration platforms. Other ones require somebody else to do something to you. Using all of them, I understand, would be very time consuming and expensive. So instead, what I want to share with you is one simple thing that you can begin using right away to reduce your pain levels without spending any money and without spending a great deal of time. And the reason that I'm showing you this specific technique is because regardless of where you're having pain in your body, the goal when you're starting out, when you've been in pain for a long period of time, is just to start producing as much kinetic flow as humanly possible. And when it comes to producing kinetic flow, there's just no question, looking at the data from Roger Sperry, that coupling motion of the spine gives us the most bang for the buck. Okay? What does that mean? What I'm going to show you now is a technique that I call chin to shoulder. And what you need to do to perform this technique is to sit up straight and tall. What we're working on here is establishing normal range of motion in the neck. Now, normal motion means two things, okay? First, normal motion is pain-free, okay? Anytime you're moving and you experience pain, that is automatically abnormal. And the second thing is something called coupling, which I touched on. But now we're going to talk about exactly what it is. See, because of the unique joint angles in your spine, anytime you go to move your neck through a rotational or a side bend range of motion, it's actually moving through two planes of motion simultaneously. If you take either one of those two planes out of the equation, you are moving in a non-physiological way. You're moving a joint the way that it's not intended to be moved. So we're going to focus on moving it exactly the way that's intended. So you're going to sit up straight and tall, or stand, which would be even better. And what you're going to do is you're going to imagine a dot here on the tip of your chin. You're going to imagine a second dot here on the top of your shoulder. And then what you're going to do is you're going to slowly and deliberately move your neck rotationally to the side and downward. So rotationally to the side and downward. Chin is going to come down. You're going to try and connect the dot here to the dot here. In a slow, deliberate motion, you're going to slowly come back to center and then go to the opposite side. Back to center, dipping the chin down. The motion is diagonal. This is really, really important. For somebody who has a longer neck, they'll have more of the chin down motion. But that's really important. There's no pure rotation. When you see me rotate pure, see that big gap there? That is non-physiological motion when you see that big airspace between my chin and my shoulder. So that should be closed. Now, one of the things that I tell my patients as they're going back and forth with this motion is use your eyes to drive the motion, okay? This is what makes it relevant. So I always tell my patients, like, pretend like you or even put an object on the floor behind you. Take my little remote here and put it on the floor there. And then I'm going to look over my shoulder and spot that remote control. Another thing that I'll do is I'll use a power outlet on the wall that's like 15 feet behind me, and I'll turn over both sides and I'll just go back and forth spotting that power outlet. So using the eyes to drive the motion makes this a relevant thing. It says to your brain, I'm not just going through this for the sake of doing it. I'm actually doing it to spot what's behind me, which is a natural human instinct. We're designed to watch out for things that might be coming to get us, or to look out for things that we can go and get to feed ourselves. Now, one thing that I want to address, and this is really, really important, so make sure that you perk up for this. If it hurts, that's important information. So normal range of motion would be 90 degrees. I can get my chin perfectly in line with my shoulder to both sides, and they go equally far and neither side hurts. But a lot of what I see in practice is that one side, first of all, most people can't get to 90 degrees, or one side will not go nearly as far as the other. So here's what you do in those cases. You're going to find your limit, find where you experience pain, and then you're going to go right up to it. Just before it happens, you're going to stop. So say I can go to 90 on this side, but I can only get to about 70 here. Well, I'm going to go to 68 degrees on this side, and I'm going to do full 90 here. And you're just going to go back and forth, working that. Now, here's how you make improvements. You go up to that 68 degree mark, and then you do that a few times. And once you've done it about 5 or 6 times, then you try and go a millimeter further, just a teeny bit further. Try it again. See if you can, as you work through it and you stimulate kinetic flow and you lubricate those joints, you should find that you're able to go just a millimeter further. And what you do is you slowly build that up over time to the point where if you're starting out with 40 degrees, hey, I made 45 degrees. That's awesome. Because when your range of motion goes up, you get into what we were just talking about with kinetic flow, where motion is going up, pain levels will be going down. If you take 40 degrees and turn it into 70 degrees, now you've made a massive difference in the amount of kinetic flow that's coming into your body. This is chin to shoulder. If you work with it in a progressive manner, meaning you try and push your range of motion, you can get a lot out of this very simple exercise. My patients do it throughout the day, about once an hour, especially with the COVID, everybody working from home. I have them get up from their computers, take a break. They do it about 10 to 15 times a day. Get up, you do 15 repetitions to each side, and you're done. It takes 30 seconds. So powerful tool, chin to shoulder. I hope you guys will take advantage of this one. Moving on, secret number 3. I hope you guys can see so far why kinetic flow is so important. The secret number 3 is basically how to take this to the next level, because what we need to eliminate pain forever is a strategy that allows you to increase kinetic flow all hours of the day without even having to think about it. That's what we're going to get into now. So I touched on this at the outset of this presentation, but there are 1.5 billion people in the world that are currently suffering with chronic pain. Okay, it's a huge amount of people. But the scary thing is that according to leading medical journals, that number is expected to increase significantly in the coming years because of 2 main factors. Now, factor number one is a general aging of the population. That's actually a good thing. People are living longer, but unfortunately, there does tend to be a higher incidence of pain with increasing age. But this is also a factor that there's not a lot that we can do with, other than making the lifestyle decisions to make sure that you age gracefully, which you should be doing really whether you're in pain or not. The second factor is super interesting. The second reason why leading medical journals are predicting a huge increase in the number of people suffering with chronic pain is a global population shift. That's people moving away from lower income countries and a traditional lifestyle to more developed regions of the world and the adoption of the modern lifestyle. Now, why is this a big deal? This is a big deal because although chronic pain, people experience chronic pain all over the world, people in all parts of the world do not suffer from chronic pain at equal levels. Okay, it's not evenly distributed. In fact, if you look at the developed regions of the world, which is on this image, the regions that are indicated in green, you'll find that chronic back pain levels, again, this is the most common form of pain in the world, something in the neighborhood of 500 million, so a third of the total people in chronic pain are suffering with back pain. And the chronic back pain incidence in those green countries is 200 to 400% greater than it is in undeveloped countries. And even if we scrap the developed countries and take them off the table and just look at undeveloped countries in isolation, we'll often find that back pain rates are 2 times higher among urban populations than they are among rural populations. So when I found this out, I was like, what's going on? We're predicting a massive increase in the number of people in chronic pain. We're seeing that it's associated with the modern lifestyle, and yet we're walking right into it. Well, what's going on? What gives? And so the main reason for the increase in pain that's associated with the modern lifestyle comes right back to secret number 2 in kinetic flow. See, modern living contains the perfect recipe for pain in that it revolves heavily around activities that suppress kinetic flow, and it's increasingly lacking in activities and opportunities to kinetic flow. And remember, according to Husheng Hushman's research, when kinetic flow goes down, pain levels go up. It's inevitable. So, if you want to get proof of just what's wrong with the modern lifestyle, just pay attention next time you go to the airport or big train station or a shopping mall and watch as people line up to take the escalator while the stairs remain completely empty. Just pay attention to that and that alone. Now, I realize that that's just one example, but it is representative of the trend that's associated with modern living. We just don't move like we're supposed to, like our body's conditioned to move. Another thing that happens with the adoption of the modern lifestyle is that we spend way more time in what are called flexion-based activities. Now, what that means is we spend way more time seated with our heads down and our arms out in front of us, usually in a grasping position. So we're closing our body down. Think of flexion-based activities as taking on the fetal position. Now, this position inevitably results in decreased kinetic flow, which is why head, neck, shoulder, all types of back pain have been directly linked to sitting in the scientific literature. In the modern world, this position is it's a way of life. All levels of schooling and most jobs in modern society, especially now with COVID, are performed from flexion-based activities, as is the commute to and from the workplace, which is, again, less of a problem now with COVID, but it seems that people are spending more time in these flexion-based activities, if that's even possible. And when you add to this fact that much of our leisure time is now spent in these activities, things like texting, spending time online or social media, playing video games, or binge watching your favorite shows on Netflix. You know, all of this is flexion-based activities, and this just paves the way for chronic pain. Now, there's one well-known pain author who would have you believe that the pain that's associated with sitting is just because you're not sitting properly or in whatever special way she deems to be superior. But I want you to know that the research doesn't support what she's saying. On the contrary, the research is very clear that sitting is a problem no matter what position you do it in. Across multiple studies spanning tons of different countries and different cultures and nearly 20 years of research, the same pattern consistently emerges time and time again, where sitting is ranked as the #1 position for aggravating back pain. And there's a very clear pattern that the more time you spend sitting, the higher the likelihood that you're going to experience pain. So what do we do about that? What can be done to decrease the pain levels that are associated with sitting? Just increase kinetic flow. That's what a bunch of researchers at Erasmus University in Rotterdam did. They created this fancy machine that would move the seat of a person's chair while they were sitting in it. And what they wanted to see was how people's pain levels would be affected by the introduction of movement with prolonged sitting. So they took a bunch of people and they split them up into 2 groups, and they just had them sit. One group sat in traditional chairs and the other group sat in this fancy moving chair. Okay. And they had the subjects rate their pain levels at the beginning of the test and then every 10 minutes throughout the test. Check out what they found. This is really cool. The group that sat in traditional chairs, the kind that we all sat in school, had nearly 80% of the people in this group had increasing pain levels. Okay, their pain levels went up from what they started from because they were sitting in these chairs, or while they were sitting in these chairs. Excuse me. 3% of the people in the traditional chair group actually had to stop because their pain levels became so excruciating that they just couldn't go on. Now, in the moving chair group, the group that had that kinetic flow going, what do you think happened? What happened was really cool. 30% fewer people had increasing pain levels, which is really neat. But what's even better is that almost a quarter of the people in that group, 22% specifically, had a complete resolution of their pain. Their pain went away as a result of being in the moving chair. Absolutely fascinating. But what was really interesting about this is that the researchers ran into the same problem that the whole body vibration researchers did in explaining their results. They said, quote, "There's no clear explanation for its healthy effect," which is movement, the healthy effect of movement. But they go on to state that the positive effect had 3 likely factors. The first was tissue conditioning. In other words, moving back and forth created more healthy connective tissue and muscle tissue. They speculated that it increased postural improvement via movement, which was later shot down in their discussion because they said that it didn't go on long enough to actually create that. And the final thing is what they call neuron stimulation, which, if you remember back to whole body vibration study that we talked about, they said the exact same thing. Increased neuronal stimulation led to decreased pain levels, and in this case, a quarter of the people experiencing complete resolution. That increased neuron stimulation, again, you guys, is kinetic flow. So there's no doubt that all the flexion-based activities that we're engaging in modern society for hours on end, day in and day out, starve our brains of kinetic flow, and that starvation directly leads to increased pain levels. We've also already seen how the modern lifestyle greatly reduces or eliminates altogether opportunities to stimulate kinetic flow. Now, you put those 2 factors together, and it's not hard at all to see why chronic pain is such a big problem in modern society and why we're expecting it to go up so much in the coming years. See, either one of those 2 factors taken on their own has the ability to absolutely wreak havoc on your health. But when you put those 2 factors together, and you add in the force of gravity, you get something called posture prolapse syndrome, which magnifies the destructive effect on your health exponentially. So what exactly is posture prolapse syndrome? Well, imagine you're going to SeaWorld for the first time ever. You're super excited because you're finally going to get to see Shamu up close, right? This amazingly cool creature. When you finally get to the park and make your way to the Shamu's enclosure, and you weave your way through the crowd and you get your first glimpse of this incredible creature, this strong feeling of concern comes over you. You kind of step back. What's wrong with Shamu? You think to yourself. Is he sick? Is he sad? Did he get injured? Why is his fin flopped over, hanging limply to the side like that? See, you don't have to be a marine biologist to realize that something is wrong when looking at this image. A killer whale's dorsal fin is made up of dense connective tissue. And when killer whales do what they do in the wild, that tissue is strengthened and molded into this beautiful upright structure. But when you pluck that animal out of its natural environment and place it in a small pool, the tissues of its body weaken and atrophy, and that fin flops over. Now, experts estimate that less than 1% of wild orcas experience what's called fin collapse, which is what you see here. While in captivity, those same experts estimate that nearly 100% of males in captivity experience fin collapse. Now, the regular occurrence of fin collapse has been attributed to a few factors. Limited space to move around, too much time spent at the surface, and a lack of movement. Sounds a lot like modern living, doesn't it? And then if it does, you won't be surprised to know that the exact same type of predictable, repeatable structural changes can be seen in us when we're exposed to lack of movement and too much stagnation. And that's what posture prolapse syndrome is. Posture prolapse is the progressive deterioration and collapse of all of your body's secondary curves and the loss of corresponding functionality that's associated with having those curves. So the easiest way to spot posture prolapse syndrome is by identifying what's called a forward head position. In recent times, we've started referring to this as tech neck or text neck. So when viewing the body from the side, normal posture would be that the whole of your ear is lined up directly over the center point of your shoulder. But if you see in this image how the ear is pushed way out in front of the body, that's a forward head position. Now, unfortunately, modern society is witnessing this type of structural dysfunction on a absolutely massive scale. The 6 most recent around with this, which means that when people are seeing this posture, they're not even recognizing that it's evidence of massive dysfunction. I mean, it would be like if you had only ever seen killer whales at SeaWorld and never in the wild, you would have no way of knowing that that flopped over dorsal fin is actually indicative of dysfunction. Now, other signs of posture prolapse beside a forward head position are an overdevelopment of the muscles here at the base of the neck called the upper trapezius, hyperkyphosis, which is excessive rounding of the upper back or that hump that people get here, which is also becoming very common nowadays, rounding or turning in of the shoulders where you're looking at the knuckles when you see somebody from straight on, loss of curvature in the lumbar spine, flattening of the butt, clawing of the hands, where the thumb pulls in or the fingers won't straighten all the way. And then you also find changes in the feet where you get flattening of the feet, loss of the arches, and then bunion formation, all classic signs of posture prolapse. Now, these structural changes are also accompanied by physical dysfunction. So people cannot move the way that they're supposed to. They feel mobility restriction. Chronic stiffness is something that we see every day in the clinic. People complain that they're not able to move or do the things that they used to be able to do. We also see decreased energy levels and fatigue because it takes a ton of energy to hold yourself in an inefficient position all day long. And then, of course, chronic pain. In fact, chronic pain has been directly linked to each of the structural changes that we just spoke about, and therefore linked directly to the most common pain conditions in the world. And despite being completely overlooked by conventional medicine, these types of structural changes that we just went over, these physical changes to our posture, have a ton of valuable information to offer us when it comes to resolving chronic pain problems. For example, this study from the Journal of Physical Therapy found that people with forward head position, rounding of the shoulders, and the bump or the hump here on their upper back had way higher incidence of headaches, neck pain, and back pain. This study from the Journal of Oral Facial Pain found a direct relationship between forward head position and TMJ, chronic jaw problems. This study from the Journal of Orthopedic Sports Physical Therapy found that there was a direct link between forward head position, a structural change, a loss of range of motion in the neck, a functional change, and carpal tunnel syndrome, one of the most common conditions affecting the upper extremity in the world. So direct link between those three things. This study from the journal Headache found that people with forward head position were way more likely to suffer from headaches, and that the degree of forward head position correlated with the intensity of the headaches. So the people that had the worst forward head position experienced the worst kind of headaches. They also had knots and chronic tension here at the base of the skull and down here at the base of the neck, what are called trigger points. And then this study, absolutely amazing, 2015 Journal of Shoulder and Elbow Surgery, found that people with the worst type of posture prolapse were 22 times more likely to experience rotator cuff tears than people with normal posture. So these structural changes give us the ability to predict with a high degree of accuracy the types of physical problems that people are going to be experiencing. And these results were summed up beautifully by one presenter at the International Fibromyalgia Conference in Seattle a few years back. The guy stated that his name is Dr. Herbert Gordon. He stated, quote, the major portion of head, neck, jaw, and shoulder pain experienced by people with fibromyalgia and chronic fatigue and immunodeficiency syndrome was attributed to the head and neck posture of the sufferer. The major portion of their pain was attributed to their head and neck posture. Okay. That's a big deal when you're trying to resolve these problems. You need to know that stuff. And the truth is that pain is really only the beginning when it comes to the problems that are caused by posture prolapse syndrome. Posture prolapse syndrome interferes with life in a major way. Basic activities of daily living become way harder for people with posture prolapse. You're talking about everything from bending, getting up from a chair, climbing stairs, grip strength, taking a walk. All of these things become harder with posture prolapse, which is why posture prolapse has been tied to loss of independence and an increased need for assisted living among the elderly. I mean, posture prolapse syndrome even interferes with the most basic activities of daily life, which is breathing. It can even get in the way of breathing. You see, what happens is as that head pushes out in front of the body, your body becomes increasingly unstable. Basically, your brain feels like you're going to fall on your face. And so what it does is it locks down the middle portion of your back, cinches everything down. But because that's where your ribs attach, they get cinched down as well. This leads to a rib cage that can't open and expand, and therefore can't make room for lung expansion. So what they've found is that for people with severe posture prolapse syndrome, they can lose as much as 30% of their lung capacity, 30% of their ability to inflate their lungs and oxygenate their cells goes right out the window. What that means in practical terms is that for a person with severe posture prolapse living at sea level, they would experience the same oxygen availability as a person with normal posture would experience at an elevation of 11,000 feet. I don't know how many of you have been up that high, but living life at that elevation seems incredibly difficult and should be avoided if at all possible. The Journal of the American Geriatric Society took it a step further, and they found that you could actually use the type of structural changes that are associated with posture prolapse to predict mortality. And what they found was that people with posture prolapse were 2.5 times more likely to die from atherosclerosis. They were twice as likely to die from pulmonary causes, and almost 1.5 times as likely to die from anything and everything that's all-cause mortality. So posture prolapse syndrome doesn't just starve you of kinetic flow, it starves you of oxygen too. These are two essential nutrients that your body needs in order to be able to function properly. And it doesn't just rob you of these essential nutrients in the moment, like holding your breath underwater does. And then when you come to the surface, all is fine. these effects bioaccumulate. They build up in your body so that the damage actually compounds over time. And if you don't do something to fix it, it creates dysfunction every minute of every day until it robs you of your ability to move altogether. So what I want to do now is I want to give you guys another tool. Like I said, I want you to come away from this presentation with a couple easy strategies that you can do to help yourself. So what we're going to talk about now is one simple strategy that you can easily begin using every single day to help restore the normal structure to your body. Put that normal secondary curve back into your neck. This is going to help you to increase kinetic flow and decrease pain all hours of the day without having to do any conscious effort. The best part is that you can start doing this from the comfort of your own bed with no additional time commitment whatsoever. So the technique that we're going to be talking about is called spinal molding, and how it works is really simple. See, the ligaments in your body work very differently than muscles and tendons do. When you pull a muscle or a tendon apart, it functions a lot like a rubber band. So you pull it apart and it'll spring back together, right? Ligaments don't do that. Ligaments undergo something called plastic deformation, which means that if you bend them into a shape and you hold them there long enough, they will actually take on that shape. So spinal molding takes the concept of plastic deformation and it uses it to our advantage. So all you need to do is roll up a small towel to about a 3-inch diameter, okay? 3 inches around. You're gonna lie flat on your back. I usually instruct my patients to do this when they get into bed at night. If your bed is a little firmer, this will work better. Otherwise, you may have to get down on the floor and do it there if you have a super soft bed. But basically, what you're going to do is roll up that towel to 3 inches. Make sure it's perfectly rounded, perfectly rolled, it doesn't flatten out, and that it stays tight. You're going to place it down here at the base of your neck. So way down here where your neck meets your shoulder. And you're going to lie flat on your back. Now, it's really, really important that the back of your head here, not the top of your head, is in contact with the surface that you're lying on. So if you place that roll in there and you find that your chin shoots up in the air, then what you're going to need to do is bend your knees like you see in this image where I'm bending, and that's going to help flatten you out and get that chin down. You're going to know you're in the right position with this roll when it's here where the neck meets the shoulder and that your chin and your forehead are in line with one another. Again, you can bend your knees if you have difficulty getting the back of your head into alignment. And then what you're going to do is you're just going to lie there. You're going to lie there and you're going to allow plastic deformation to take place. And what's going to happen is your neck is going to take on that shape. Now that, with the roll in there, you're pushing the secondary curve back into the neck. You're getting your body back into its normal shape. You're essentially going in the opposite direction of being on a laptop or texting all day long. And this is going to help reverse those degenerative changes. Now, when you start out, it's really important to understand that this is a powerful technique and you're dealing with ligaments that change slowly and have a very poor blood supply. So you need to take it easy on these. They don't respond the way that muscles do. So you go slow and easy. If you have severe posture prolapse syndrome, you may start out with as little as 30 seconds. So you go on your roll, do your 30 seconds, make sure that everything is relaxed, and it should feel good when you're doing it. You should find that you breathe a little easier if you have tension here in the neck, in the front of the neck, or here at the top of the shoulders, you should find that goes away when you're doing this. It should just feel good. But like I said, 30 seconds might be enough. If 30 seconds is okay, you can push it to a minute, but I wouldn't go much further than that when you're first starting out, because like I said, this is a very powerful technique. But that's what I have people do. Do a minute of that when you get into bed each night, and then just take that roll out, and then you can go back to your normal sleeping position. But this is a great way to start pushing the normal curvature back into your neck. So it's what I call structural restoration, excuse me. The purpose of spinal molding on a base level is to get your ear to stack directly on top of your shoulder. It's to take you away from what you see here and the left side of your screen and push you towards that nice upright posture. And what this is going to do, it's going to do a few things. First, It's going to put that secondary curve back into your neck. It's going to improve the alignment of the joints and therefore make it easier for you to move through an increased range of motion. Like we talked about, when range of motion goes up, pain levels go down. It's also going to help relax the tense muscles in your neck, because the further that head shoots out in front of your body, the more your body tenses up to support an unbalanced load, and a load that your body feels is in constant danger of falling. Remember, increasing kinetic flow by having you move better with the joints in alignment. This is the #1 factor in the scientific literature that's associated with decreasing pain levels. So this is a huge benefit. Getting your structure right will help you to get your kinetic flow right. And the changes that you're going to experience when you up that kinetic flow all hours of the day are absolutely incredible. You're talking about ability to move better, reduce pain levels, of course, increased mobility, more energy levels. You're going to look and feel younger just by being in that upright posture. You're going to have improved functionality. You're going to be able to do more of the things that you love. You're going to have more energy to do those things. You're going to have a better mood. You're going to sleep better at night, and you're going to suffer less injuries. All the things that we just covered. And who wouldn't want all of those benefits? So are you guys starting to see all of the benefits that come with increasing kinetic flow and getting your structure and your functionality right? I hope so. Are any of you feeling just a little bit overwhelmed because we just went over so much stuff? Well, if you're feeling excited to take advantage of the changes that you can make and the quality of life that you can improve and gain on with just these types of simple things, then I'd like to share something with you. I'd like to take about 10 minutes of your time and go through a special offer that I've created to help you do exactly those things, to take advantage of all of those benefits. So I created a program that's designed to give you the knowledge, the tools, and the specific action plan that you need to up your kinetic flow and fix your functionality and fix your posture forever. The program is called the Pain Fix Protocol, and it was created just for that purpose. The Pain Fix Protocol consists of 7 instructional modules that are available online immediately to you. In these modules, we're going to cover all the different types of pain. We're going to talk about the significance of the secondary curves of your body and the direct relationship between structure and functionality, how the way that your posture is holding is related to the pain that you're having. We're going to establish clearly defined standards for both structure and function. And the cool thing is that if you can reach and maintain these standards, then your odds of being in chronic pain drop off to almost nothing. And finally, we can outline a science-based strategy for the permanent resolution of the most common chronic pain conditions in the world. Now, when I work in my office, the people that come in suffer from all kinds of different things. You're talking about things like MS, Lyme disease, fibromyalgia, of course, chronic neck pain, back pain, shoulder pain, foot, ankle, wrist, all of these things, chronic fatigue. But the one thing that all of these people have in common is pain. So when I created this program, that's who I had in mind. This program is literally created for anybody that's sick and tired of having their quality of life sucked away by pain. Anybody that can't do the things that they want to do anymore, the Pain Fix Protocol is for you. So I want you guys to hear from one person who went through the program in her own words.
My name is Joanna Dudley. I am a patient of Dr. Witten. I've had debilitating chronic back pain basically my whole life since my early 20s. So I sought out Dr. Witten, and I liked that he had a holistic approach to his program. He knew I had muscle weakness, joint pain, low energy, and he gave me very simple exercises to do that were manageable. So I was able to stick to his program. And I have to say, within a few sessions, I had a dramatic reduction in pain. And so I was very excited. I've had lower back pain for 20 years, and I can't remember the last time I woke up without some discomfort in my lower back. And I have to say that after 8 weeks, I started seeing Dr. Witten in mid-January. It's now mid-March, and I have not felt this good energy-wise in probably a year and a half, lower back pain-wise in almost 2 decades. So thank you, Dr. Witten.
Now, in addition to the instructional modules that we just talked about and understanding the theory behind the resolution of pain, we're also going to give you the solution series. So these modules cover the region-specific issues for the most common pain conditions in the world. You get 7 different regions with the Pain Fix protocol. We got everything from neck pain to mid-back pain to shoulder pain, low back pain, hips, hands, feet, wrists, and ankles. These are going to teach you how to uncover the deep underlying issues that are creating your problems in the first place. They're also going to give you specific strategies to begin knocking these problems down one by one. Now, these solution series are directly pulled from my patient library. These are the same programs that I've used and perfected over the last 15 years to help people just like you resolve these problems. They do one other thing that's really cool, which is they streamline this whole process. See, if you were to go see 10 different practitioners, body workers, chiropractors, physical therapists, medical doctors, you'd end up with 10 different answers for what's causing your problem, 10 different theories for what you should do about it, and 10 different sets of solutions for exactly what you need to do to help your situation. But when you start off with understanding the specific factors that are contributing to your problem, as well as an understanding of what's required to feel good and function optimally, and then you begin closing the distance between those two things, you're going to be amazed at the results that you get. You can think of the solution series as your roadmap to resolution. What they're going to help you do is close the gap between your physical experience with pain, the outward objective functional experience with pain, your limitations, and your inner emotional experience of pain. They're going to make you understand how those two things relate to one another. And by doing that, they're going to give you the knowledge and the certainty that you need to stay on the road to resolution. Chronic problems, you guys, require chronic solutions. You need to work on this for a period of time in order to dig yourself out of it. But when you understand what's going on, it's easier to stay on that road to resolution because you can spot the signs all along the way that are showing you that you're getting better. Now, you're also going to get what are called the daily movement protocols. These templates take the strategy directly from the solution series and they transform them into easy to follow mini programs that are made up of little daily action steps. So you're going to know exactly what you need to do every single day in order to resolve your pain. When I first began working with people, patients, it didn't take me long to realize that almost everybody had the same questions. What order do I need to do the movements in? What time of day? Is this specific movement better for the beginning part of the day or the end part of the day? The Daily Movement Protocol puts the answers to all those questions right at your fingertips. We have them broken down according to the specific region of the body. They're broken down week by week. So going into each week, you know exactly what you're doing. You know which movements are old and which ones you're already familiar with. And they're even broken down according to the time of the day. So you know whether it's morning or evening, you know exactly what you're doing. Now, in addition to the Daily Movement Protocol, you're also going to receive the Progress Tracker. Now, these templates allow you to easily measure and track your improvement on your way to permanently eliminating your pain. They condense the information from what are called the quick screen self-assessments, the techniques that we use and the tests that allow you to figure out which issues are contributing to your problem. And these allow you to basically follow along with those testing strategies and then mark down your results and then come back and retest and see the improvement as you go. So with those two tools, the Daily Movement Protocols and the Progress Tracker, you're going to save yourself tons of time. You're going to save yourself thousands of dollars on doctor's visits and prescription drugs. And most importantly, you're going to save yourself months, years, or even decades worth of low quality living. My only request is that you take the money that you've saved and spend it doing something that you didn't used to be able to do because you were in so much pain. Now, you might be saying to yourself, it can't be that easy. I've already read this person's book and that person's book. I've already worked with so-and-so, and they couldn't figure out my problem. So how is this going to be any different? I hear the exact same thing from almost every single person I work with. But the truth is that it actually can be that simple when you begin focusing on the right problems, the right issues. See, it's true that chronic pain is a complex, multifaceted issue, but it's also true that the same factors are often setting the stage for these types of conditions. And when you begin keying on those issues, the downstream stuff has this amazing way of taking care of itself. Now, in addition to those tools, you're also going to receive the Pain Fix Protocol video tutorial series. This includes over 70 instructional how-to videos. Again, we're going to cover all of the quick screen self-assessments in great detail, as well as all of the rhythmic movements that you're going to be using to eliminate your pain. Now, some people are worried that we're going to be too advanced for them, or they won't be able to follow along with this. We're going to teach you by starting off with the easiest level. So no matter where you're starting from or how much pain you're in, we're going to meet you at that level and we're going to build you up. We always start with the least complicated, least stressful version of a movement, and we build up from there. So literally everybody can be successful with this program. And the cool part is, as you achieve higher and higher levels of functionality, your pain will naturally begin to fade away. Also, as part of the Pain Fix Protocol, I'm going to include a section on optimizing your sleep. This is critically important stuff. Specifically, I want to teach you guys how to turn high quality sleep into a powerful weapon to combat pain. In this section, I share brand new research on the critical link between chronic pain and sleep, as well as going over the most common mistakes that keep people sleeping poorly and stuck in a downward spiral of pain and disability. You're going to come away from this section with real world strategies for how to sleep better every single night, as well as how to set up and strategize and prepare your nightly routine to decrease and eliminate pain while you sleep. Now, when it comes to resolving chronic pain, you guys, this is the lowest hanging fruit there is. It's the easiest stuff, and you want to make sure that you snatch as much of that up as you possibly can. This section is going to show you exactly how to do that. So all told, with everything included, the total value of the Pain Fix Protocol is over $3,000. I have no intention of charging you that much because my goal is to get this information out to everyone out there that's in need. But I do want to put that price into perspective, because if you were to come and work with me directly in my clinic, the average total cost of a treatment and rehabilitation program for people that are suffering with chronic pain is over $4,700. When people put down that money in the clinic, they don't view it as an expense. They view it as an investment in their quality of life. But because, like I said, I want to get this out to everybody that's suffering, I priced the Pain Fix Protocol at just $499. I'm going to do you guys one better. As a thank you for spending Saturday morning with me, I am going to make this program available to everybody on this call for just $299. $299 for everything that's included in the Pain Fix Protocol. If I hadn't said this yet, it is a lifetime membership, you guys. You get access to this information for life. All you need to do to qualify for that price is enter code PAINFREE in the checkout. So now it's decision-making time. As I see it here, you have two choices. Choice number one is to do nothing. Just continue doing what you've already been doing, and you'll keep getting the results that you're getting. It's important to me that you know I never force anybody that comes into my office. I never twist arms. I'm not a hard sales guy. If somebody doesn't want to put in the work, they're not going to be successful. However, if you're willing to make some changes to the way that you think about pain, if you're willing to change what you're doing, and most importantly, if you're willing to change the results that you're getting, jump into this program with both feet and see what this Pain Fix Protocol can do for you. The best part about this, you guys, is you have nothing to lose. I'm so confident that this program will reduce or eliminate your pain that I'm giving you a 30-day, 100%, no questions asked money back guarantee. Okay? But if you jump into this program with both feet, you're not going to need it because you're going to be well on your way to permanently eliminating your pain in just the first 30 days. So the real question is it worth taking a few minutes of your time to check this out? You got nothing to lose. 30-day, no questions asked. But if the Pain Fix protocol can resolve even half of what you're dealing with, your life is going to be that much better off for it. So again, when you invest in the Pain Fix protocol, you're getting all of this. Total value of over $3,300. And that's not all. Purchase of the Pain Fix protocol also comes with a private membership access to our group, our Pain Fix protocol community in Facebook. Here you can check in with me personally. We can, you can ask questions. We can come together and find solutions. I do this for my members. I'm active in the group almost every day, and you get access to brand new content. Here's what some of my members have said about it. Thank you, thank you. I've been doing the exercises from the HIP protocol for a few weeks now, and the improvements are remarkable. I'm so excited to be moving away from my groin pain and now looking forward to getting off of my prescription altogether. I'm completely thrilled. This person says 6 weeks into the HIP fix, my pain in that region went from a constant 6+ to a 1. This member said, I'm so grateful for this program. I have advanced posture prolapse and have improved greatly. The difference in the way that I feel is quite dramatic. Thank you so very much. And then finally, I wish I would have found you sooner in my life. I've spent the last 35 years seeing chiropractors and getting lots of massages, but never got lasting relief. I like the feeling of getting results from doing the work of the Pain Fix exercises. I've made more progress in the last 6 months than the prior 30+ years. So that's what some of my members are saying, you guys. And in addition to the private member group in Facebook, I went one step further. I teamed up with a couple of experts in the fields of health and neuroscience to add even more value to this program for you. I teamed up with, first and foremost, my brother, who has a large online presence and an incredible podcast. If you guys haven't checked out the Energy Blueprint, wherever you view podcasts, check it out. Lots of good health information there. He did a huge section in my in the Pain Fix protocol on using the power of light to transform your body into a healing machine and to eliminate pain. This is one of the most cutting edge areas of new research in science, and in the next 10 to 20 years, you're going to be hearing a lot about using light therapy for different types of conditions, healing and pain among the forefront of those. And then I also teamed up with best-selling author and neuroscience researcher Mark Waldman, who did a fantastic presentation on mindfulness and harnessing the power of the mind to overcome chronic pain conditions. I'm so excited to have these two amazing authors as contributors for the Pain Fix protocol. But the most important thing is that the inclusion of these two sections makes the Pain Fix protocol the most comprehensive program ever created for the permanent resolution of chronic pain. The existence of this program means you don't have to live in pain anymore. You have the power to change your situation. All the right tools and the strategy that you need are here waiting for you. And I hope that you will join me and join the Pain Fix protocol community, and let's start eliminating your pain. When you sign up, you're getting all this: the masterclass, the solution series, the daily movement protocols, the progress tracker, the video tutorial series with over 70 instructional videos, the sleep optimization protocol, my brother Ari Witten's light therapy and healing guide, and Mark Waldman's mindfulness and pain reduction strategies. Total value of over $4,500 for just $299 for those of you on this webinar. Just make sure that you enter code PAINFREE at checkout, and let's start resolving your pain.